Lassa fever is an acute viral hemorrhagic illness endemic in West Africa. It is a member of the arenavirus family. Humans usually become infected with Lassa virus through exposure to food or household items contaminated with urine or feces of infected mastomys rats. Transmission of Lassa virus to humans occurs most commonly through injection or inhalation. Mastomys rodents shed the virus in urine and droppings, and direct contact with these materials through touching soiled objects, eating contaminated food, or exposure to open cuts or sores can lead to infection. Individuals at greatest risk of Lassa virus infection are those who live in or visit endemic regions like Sierra Leone, Liberia, Guinea, and Nigeria, and have exposure to the multi-mammate rats. Risk of exposure may also exist in other West African countries where mastomys rodents exist. The disease, described as indigenous disease, is an endemic disease that was first recognized in Nigeria in 1969. Humans are said to have contracted Lassa virus primarily through contact with contaminated excreta of the rodent Mastomys natalensis, which is the natural reservoir. Secondary transmission between humans occurs through direct contact with infected blood or bodily secretions. There are currently no approved vaccine for Lassa fever, which is lethal in humans with a mortality rate as high as 70% in hospitalized cases. As many as 500,000 people are infected each year in West Africa. The latest report from Nigeria Center for Disease Control, NCDC, shows death toll from the Lassa fever outbreak in Nigeria in 2022 was 189. The report also shows that the confirmed cases for last year rose to 1,067 across 112 local government areas of 27 states as at 8 January 2023. Global Health Digest this week focuses on what could be done to stop the yearly outbreaks of Lassa fever. I am Uche Ugochukwu. Let's watch this background report.
Lassa fever is an animal-borne zoonotic acute viral illness spread by the common African rat. It is endemic in parts of West Africa, including Sierra Leone, Liberia, Guinea, and Nigeria. Neighboring countries are also at risk because the animal vector lives throughout the region. The first documented case occurred in 1969. About 100,000 to 300,000 infections of Lassa fever occur annually, with about 5,000 deaths. Surveillance for Lassa fever varies between locations, so these estimates are crude. Signs and symptoms of Lassa fever typically occur 1 to 3 weeks after the patient comes into contact with the virus. Mild symptoms include slight fever, general malaise and weakness, and headache. Respiratory distress, repeated vomiting, facial swelling, pain in the chest, back and abdomen, and shock. Primary transmission of Lassa virus from its host to humans can be prevented by avoiding contact with mastomys rodents, especially in the geographic regions where outbreaks occur. Putting food away in rodent-proof containers and keeping the home clean help to discourage rodents from entering homes. Further, educating people in high-risk areas about ways to decrease rodent populations in their homes will aid in the control and prevention of Lassa fever. Other challenges include developing more rapid diagnostic tests and increasing the availability of the only known drug treatment, ribavirin. Experts say research is presently on the way to develop a vaccine for Lassa fever.
On our street corner, we sought to know what members of the public are doing to stay safe from Lassa fever.
I've heard about Lassa
So what is this Lassa fever?
Lassa fever is a sickness caused by rats when somebody eats anything that is infested by rats. So that's it.
I'm hearing about Lassa fever, but I don't know anything about Lassa fever. Sir.
Lassa fever is a sickness all of us know that kills people. The only thing I heard about Lassa, they say is what is even causing the Lassa fever. So if I may remember, um, it's been a while, sha, but I don't think it's still existing. If not, you're asking me about the Lassa fever.
The onset of illness of Lassa fever typically comprises non-specific signs and symptoms, difficult to distinguish from many other febrile diseases. Some patients are said to progress to severe vascular instability and multi-organ system failure, with case fatality ratios in hospitalized cases of about 20%. We spoke with Dr. Sandra Mba, a public health physician and epidemiologist with the Nigeria Center for Disease Control and Prevention. She tells us the strategies in place to curtail the impact of Lassa fever in Nigeria.
Afternoon, everyone. So Lassa fever, as we know, is an acute viral hemorrhagic fever. It's caused by the Lassa virus, which is found in the rats. So what we call the Mastomys natalensis, or in other terms, multimammate rats. So these are the rats that carry and harbor this Lassa virus, and these rats distribute the Lassa fever infections to people through their saliva, through the feces, or through touching food or containers or things that have been left unkept by these rats, and then someone ingesting these. So this is one way that Lassa fever can be transmitted to human beings. Another way is as we know, majority of the times the Lassa fever usually peaks around this period. So we have the high transmission period of Lassa fever, which entails or which focuses about November, between November and March. So between these times, we have a very high peak because of the dry seasons that currently happens within in Nigeria. So because of these dry seasons and certain habits that are also fondly you know, habits that are fondly curated around this period, such as deforestation or burning of bushes. These actually forces, as well as the very hot sun in the dry season, this usually pushes those rats from the bushes or from the forest and starts coming towards the environment where the normal human beings actually live. And then certain predisposing factors such as dirty environments can also cause these rats to come into your home. So these are some of the issues and some of the things that precipitates Lassa fever to spike during this period. So in Nigeria, we have certain states that contribute to over 70% of the Lassa fever outbreak. And these states are mostly Edo State, Ondo State, and then Ebonyi. But currently, we also have Bauchi State, which is also including, which has also somewhat joined these other three states to have really high numbers of Lassa fever in Nigeria. So cumulatively, these four states especially um, accounts for almost 80% of the cases in Nigeria. And the some of the factors that we've seen with regards to certain areas with these states are just, we can't really pinpoint the exact reasons why Lassa fever is higher in these states. But we also understand certain behavioral activities with regards to these states. And part of these are the bush burnings, hunters going to farm during this period, and especially, and then environmental factors usually are things that also cultivates such rodents from coming close to your environment. Yeah. So we have Lassa fever. I mean, Lassa fever, as we know, is a viral hemorrhagic illness, and it has high fatality rates. Currently, as at 22nd of January, which gives us our week epidemiological week 3, we Nigeria has recorded over about 244 confirmed cases of Lassa fever out of 939 suspected cases. So we had about 939 suspected cases reporting from about 13 states. And then from that, we have 244 confirmed cases and 37 deaths. So this brings our case fatality rate to 15.1%. But one thing we also noted is one of the deaths was a healthcare worker, and majority of the cases for healthcare workers, they get some most of the time they are exposed to this. May not be from their environment. In some cases it is, but most of the time, because Lassa fever is highly contagious, whenever they're managing cases that are infected with Lassa fever. All right, so currently NCDC has established what we call the Public Health Emergency Operations Center. So this is the Lassa Fever Public Health Emergency Operations Center. This aims to ensure effective multi-sectoral coordination of early containment of the outbreak. It also ensures timely response as well as activities and coordination across the state level. And we've also deployed teams to 6 states in Nigeria, which is Edo State, Ondo State, Ebonyi State, Bauchi, Taraba, and Benue. So far in Nigeria, in this year, we've noticed quite a remarkable number of cases coming out from these states. So NCDC has deployed rapid response teams to support the coordination and support the outbreak response in these states so far. So what we do in this time, we distribute response commodities, we distribute medicines, we distribute IPC equipment such as personal protective equipment. We also distribute information materials for IEC materials for risk communication. We try to engage community. We try to engage them and give them information so that they can further prepare themselves and know what to do whenever they have symptoms or when they have they know someone within their community or within their center or area of living who has these symptoms and what to look out for. We also try to engage them in social behavioral change communications to ensure that they practice the right things and they avoid they try to eliminate such things that could precipitate these rats from coming to their areas. We also do what we call routine support of testing and state laboratories. Currently, we have 9 testing laboratories for Lassa fever across Nigeria, and we're also planning to expand this as much as possible and trying to see how we can expand further to at least having up to maybe 12 to 15 testing laboratories in country, and we're currently doing that at the lab section. We also engage contact tracers and we also did what we call distribution of keeping your environment clean would help eliminate these rodents from coming towards your environment. We also encourage Nigerians to block all the holes in your houses that could have that could harbor a rodent to allow rodents to pass through or gain entry into your home. And then we tell people to avoid spreading of foods on the floor. In some cases, a lot of cases, and this is practiced across most states, especially in the dry season, they tend to, spread maize, gari, and such type of food, and this can also precipitate infection because the rats, you're not sure what animal or whatever thing has come to where you spread your food. So we tell people to avoid drying of food outside on the floor or by the roadside where it could be at risk for contamination. We also tell Nigerians to store the foodstuffs like rice, gari, maize, corn in sealed containers that have seals and are tight fitted lids, just so that they can prevent entry of these rodents as well. And we also tell Nigerians to, as part of the environmental habits, cover up your dustbins, dispose of your refuse, and empty it out. If you want to have a general, refuse bin, keep it far away from your house if you can, so that you can reduce the rodents from coming closer, and avoid bush burning because these are what can lead to displacement of these rodents from their bushes to the human dwellings. We also ask people to eliminate the rodents from your house if you have one, and practice good personal hygiene. Wash your hands at all times. COVID-19 has taught us that we should always wash our hands or use alcohol-based hand rubs. So do that. And then visit the nearest facility once you notice that you're sick. Don't self-medicate because we have issues because of such as antimicrobial resistance and so on. So avoid self-medicating. It could save your life. It could help reduce our case fatality rate, and it could help you get the appropriate treatment that you need in good time.
Dr. Kasmia Ifeanyi also joined us via Zoom to share more thoughts on Lassa fever. Dr. Ifeanyi is an infectious disease expert and public health analyst. With emphasis on the need for early testing, he is of the view that knowing the duration of the antibody response is important in estimating the true incidence of infection and interpreting prevalence data.
The reason why we as health experts, infectious disease experts, are really concerned about what is happening is that honestly, save for what the National Center for Disease Control is doing about this kind of outbreak, not much is happening. Not much is happening. You see, I still continue to fault our infection system in Nigeria. We need to put that to be optimal, fully active, because it's the only way we can feed into the active surveillance of NCDC, which will help us have real-time reportage on occurrence, incidents, and outbreaks of Lassa fever. Having said that, 80% of people infected with Lassa fever do not show symptoms. That's a huge number. And this 80% will present in our hospitals for, they could come report other ailments, whereas they are shedding the virus. And so that makes health workers, physicians, medical laboratory scientists, nurses, that will make them vulnerable. And so what we need to do as a country that is being molested and ravaged by Lassa fever is for the Federal Ministry of Health, the Federal Ministry of Science and Technology to honestly promote research in the area of the diagnosis, rapid diagnosis for Lassa fever. The diagnosis of Lassa fever has remained a challenge. It is still a matter of taking samples and couriering same to few hospitals. In the process, people are exposed. So since over 80% of people infected with this disease do not present symptoms, what is important in mitigation is that of training. Even though the people they meet in hospitals and health facilities are health workers, it's important that people are trained on how to take samples, whether the case is known or unknown. What happened sometime in Abakaliki, physicians dabbled into taking samples of patients suspected of having Lassa fever, and it took their life, meaning they were ill-prepared. They were not trained to do that. Besides, they were also not properly kitted to carry out such procedures. So now that we have the outbreak, I expect the NCDC to, beyond their own workforce, commence trainings for tertiary health workers, particularly medical laboratory scientists, physicians, and nurses, on how to manage patients, even when you are not sure. So you treat every patient as a suspect. That training is important on the use of personal protective equipment. That training is important on touch not, and all the things you must not do or what you have to do while engaging with patients, particularly those in Lassa fever endemic area and states. Hemorrhagic fevers mimic common ailment symptoms like that of malaria or enteric fever. The only thing is that when it becomes full-blown, it will have classical signs and symptoms. But at that time, it's already way in late. When you start noticing bleeding through the orifice, at that time, it is already way too late. But at the first onset, it could present like you have fever, high-grade fever, maybe vomiting, general malaise, which you know is also the core symptoms or signs associated with malaria, enteric fever, and other kinds of fever. So the the catch remains that of testing. One other area where we have huge gap, and that is why we are always caught napping with, look at the number doled out by National Center for Disease Control, those that have so far been lost to this disease under a very short period of time, 2023, that is still fresh and new. We've lost that number. Those who are already there as a result of Lassa fever disease. So what can we do to make sure that every federal medical center, every teaching hospital in Nigeria has capacity for laboratory detection? That is what is missing. If we have cases somewhere in southeast Nigeria, we will take samples and now start couriering it to Irua in Edo State. Of course, you understand that sample couriering of sample is a hazardous endeavor. So can we break that link and make sure that all these hospitals have capacity for this kind of diagnosis? And it is easy for us to do that with technology. However, we also need to look inward as a country bedeviled with this disease that is endemic for it. What can become the testing algorithm that would help facilities like a general hospital, a teaching hospital, or a federal medical center to have reasonable conclusion, conclusive diagnosis that this is Lassa fever. We do not need to be hauling sample here and there. When we have physicians who may not have been roundly trained in the detection, as they engage with patients, there should be telltale signs. So training in this regard is very important. Developing laboratory protocols for diagnosis and detection of Lassa fever is key, and that has been missing. Developing a testing algorithm that can be very cost effective, that can be deployed in secondary care and tertiary care readily, is also missing. One other thing that we need to do, the Ministry of Environment, the State Department of Environment, the state environmental health officers need to deploy. We need to do something about improving the hygiene in our living places. We need to put in place, what can we do to contain rat invasion of homes? People who process gari, who process all kinds of food items. If you travel around Nigeria, you see people spread these things by the highways, adjoining bushes, where rats will come while feeding on those things that are drying, either gari or grain, whatever it might be, will leave their droppings, fecal droppings, will leave their urine, and thereby contaminating the food. And that ultimately finds its way to the food system in the market. So there's a lot we need to do. There has to be multi-stakeholder engagement in the containment and combating of Lassa fever. That is not happening currently. Again, is that it is not only NCDC that should be on the saddle in this matter. We have NIMA, the Nigerian Medical Research. I do not know the level of research that go on there. This kind of diseases that are intractable, that have remained intractable, that have remained perennial, should become a major concern to them. And one of the things is that I have studied the act of NIMA, which good 18 is undergoing amendment at the National Assembly. But I found plenty lacuna in that particular extant act. And this amendment time provides window for us to really make it a medical research council, a medical research center, because the extant law is skewed, largely skewed. You see, the word medical speaks to the health challenges, health situations, health economics of Nigeria.
Thank you, Dr. Ifeanyi, for sharing your experience with us. With this, we come to the end of Global Health Digest this week. As we always advise on this program, you are responsible for your health. Keep your environment clean. Stay safe. Until we come your way next week, I am Uche Ugochukwu. Enjoy these tidbits.